Hello, I'm Dr. David Roberts from Manchester West Vet Hospital, and we're here for our third part on our laser therapeutic treatments for patients. We're going to talk about some things that we see specifically with our feline patients, with cats. What we know about dogs, we talked about Cruiser, is that they have problems with their hips, hip dysplasia. Even though I've seen hip dysplasia in a cat or two, I don't see it very often. When they've done some final studies on cats, they found out that they get arthritis in two areas. And instead of the hip, it's actually right here at the lower back, where the lower spine meets the pelvis or the hip joint itself. And that's where they have their predominant problem. Their second highest source is in their elbow. And the elbow is actually a part that if you think of cats jumping down, they have a lot of stress, a lot of impact on their elbow joints. So that's the two spots that we figured out with cats. What we have here today is Sharon has brought in her cat Cletus, and Cletus is going to have his lower back lasered. He actually has a little bit of arthritic change in there. He's not an old cat, but this will help keep him young if we start these therapies earlier. So Sharon has noticed that he's had some trouble getting up, jumping up on the couch, jumping up on counters. Even though that was good, she would prefer for him to be more comfortable. So we'll set Cletus up here. And again, when we do these lasers, remember the clients are here to hold on to the pet. Laura, if you want to go ahead, our technician Laura will be doing the lasering here. I can move these, and we'll all put on glasses because of the laser is a light source, so we want to have protective eyewear on. But we usually will have our client hold on to the patient while our technician actually does the lasering itself. So what Dolores is doing now is she's setting it up again for Cletus's body weight and his size, and then she'll have everything programmed, and again our laser will know exactly what to do. It will go ahead and give the right wattage, the right depth, the right temperature, and you'll see that even as a kitty cat he won't have really any pain, or certainly he's not going to have any real feeling of anything with the laser itself. Now what he will feel is warmth, and that will actually be something that will be soothing for him. This is Cletus's first treatment, so he actually will be a little bit more skittish with the noises and stuff. But once our feline patients have come in a couple of times, like many patients have, they get used to it, they know the routine, and they know that it will make them feel better. So we'll go ahead and just show how we kind of just take the wand, and he's going to go over the lower back, and we just keep that moving. She's parting his hair away, this longer hair, and what she'll do is she'll go ahead and just keep working the probe under there, and she'll wand around the entire lower back, and again, he'll feel fine with it all. He's a little nervous, probably more with the noise than anything at all right now. So, but he's doing good, and he doesn't feel a thing. And again, he'll actually feel better for all of this in the morning. So, this treatment will take about 4 minutes. So we're going to go ahead and sign off. But again, when we have looked at this therapeutic laser, we're very convinced with the few patients that we've used it on and the research and the various things that we've seen, that this definitely is the wave of the future. K-laser is the wave of the future. I'm Dr. David Roberts from Manchester West Veterinary Hospital. Thanks again for tuning in.